Dr. Christy Ennis. We all know that exercising and strength training is really important for us, right? It's really good for our bodies, but it can also be super duper intimidating if you've never worked out before, or if you've had a significant injury or illness, and I'm talking about myself here too in this. It can be like, oh my gosh, where do I start? I don't want to get hurt, I don't want to get injured, and I want to feel good. Well, that's what today's exercises are all about. Working on that whole body in a safe way and an effective way that can keep you going and keep you feeling good. All right, we're going to get started. Now for all these exercises, aim for 10 repetitions, but if you're just starting, it's 100% okay if you can't get to 10. I'd rather have you do 3 reps with good form than 10 just kind of boof repetitions. Try spelling that word. All right, so this first one is a sit to stand. So you need a nice sturdy chair. And what you're going to do is get yourself towards the edge of that chair. This makes it a little bit easier. You have a couple different options here too. The hardest is no hands. Look, Mom, no hands. Really think about squeezing into those abs and those glutes, using those legs and standing right on up, getting that little extra squeeze. This may be a little bit too much to start with. You also need to get back down too, right? Sometimes I have to look. Now, level 2, or a little easier, is keeping those hands on those legs and helping yourself push up just a little. And then even a little easier than that is using the arms of the chair if your chair happens to have arms to it. So challenge yourself to the most difficult one for you, but make sure that you have good form, right? Knees are not collapsing inwards and you're not going to fall over. So we just worked the front of those legs. Now we're gonna work the side of those legs and those hips. Again, making sure you have something sturdy to be next to. If you want to challenge your balance, this one would be a not holding on one, but again, key thing is also not falling over. You want to make sure you're safe. So finding something sturdy to hang on to, a little bend in the leg that you're going to stand on, just so you're not locking your knee. So it's just a tiny shift, not a lean. Shift, not lean. Get that in your head for sure, that's important. And you're going to take this other leg, keep those toes pointing forward, and maybe even just a touch inwards to really get those glute muscles, and you're bringing it right out to the side. Try not to let it come forward, otherwise you're really using your hip flexor muscles when you do that, but right out to the side. And with this, I'm actually using both legs. So the same muscles that are working on this side are actually working on this side to help support that pelvis. That's why you don't want to sit there and do this kind of thing. If you want to make it harder, again, you can let go. Or you can even add a little band above the knees is a little bit harder. Below the knees is even harder than that. For exercise 3, we're going to work the back of the shoulder and the back, and you need a band. It doesn't have to be a fancy schmancy one with handles. Any band will do. And something, again, sturdy to loop it over. I happen to have this awesome bar here. Not everybody has this, but you can use a railing. That tends to work pretty well. So I'm going to grab both the handles since I've got them. Gently squeezing into my shoulder blades, standing up nice and tall, and of course it always helps to engage those abs too by pulling that belly button in. Again, that gentle squeeze of the shoulder blade, and then my elbow is going to be going straight back. To add a little extra oomph to that, you can even add a rotation. Now if that's too much to start with, don't worry about it. Don't add the rotation, just stick with that straight pull back. And again, because we've got 2 sides here, trying to shoot for 10 on each side, but it's okay if you can't quite get to that 10. For our 4th exercise, we're going to work through the chest and the triceps. Obviously some other muscles too, but that's the main focus. You need a nice sturdy wall like I've got here for a wall push-up. Now, the further your hands apart are, the more you're going to work through the chest. If you bring your hands in a little bit more narrow, you'll get a little bit more tricep. I tend to start people right at about shoulder width because that tends to be a bit of a more comfortable position, but feel free to experiment. You are allowed to do that. So you're going to take your hands about chest level. I'm going to turn them out slightly because that actually helps my shoulder a little bit. You want to let your body stay straight and your elbows actually come straight back too, not flared out to the side. It's okay if your nose doesn't touch the wall all the way, but you do want to try to bring yourself as close to the wall as you can. And again, shooting for those 10 repetitions. Now, if you find that that's too easy, you can actually make it a little harder by decreasing the height of the surface. So you could find a couch or a coffee table and do a couple push-ups there and see how that works for you. You can even get all the way down to the ground, which obviously is going to be the hardest, but you can start by going down onto your knees and then advancing to all the way up onto the toes. That comes way further down the road, and it's perfectly good to start right at the wall. Our fifth exercise involves a cozy, comfy pillow, but not a nap. You can use a towel or a pillow only because you're gonna rest your arm on that wall. And for me, at any rate, it's definitely more comfortable. So this is working the side body, including those obliques. So the easiest way to start, again, is at the wall. So I'm gonna take my forearm against my pillow, trying to keep a nice flat body here. Lower my arm a little, that was too high. I'm gonna dip in a little and push out. So again, you're actually using both sides here, more this side. This side's working a little bit though as well. And the same as with the push-up, you can make this a little bit more difficult by lowering the surface. So again, you can go onto a couch or a bed or a table. And then to make it even harder, you can get down on the floor, starting, of course, with bent knees. And then the most challenging is with those legs straight. Exercise 6 and 7 will be lying down. Now I'm on the ground, but just know that you can absolutely do these in the bed, because I know how uncomfortable it can be to get up and down off the ground sometimes, which is why I actually have some bed exercise series too that I'll link for you. But please feel free to do these in the bed. You're gonna bring the heels together. There's no place like home. Turn those toes out. Bring those hands down beside you. Tiny little pelvic tilt here. So you're not totally flattening the back, but just kind of flattening it a little bit. Squeeze into those glutes, and then you're gonna lift that butt up. So this is working through the glutes and the back of the legs. With the toes turned out like this, you actually just get a little bit more recruitment in those bum muscles as you go. All right, our last exercise, still on the ground, really working those abs with this one here. Now it's called a dead bug, but I had a patient rename it the struggling turtle, which makes way more sense because dead bugs don't move and struggling turtles do. So clearly there's movement involved with this one. The key here is keeping this area through the middle nice and steady while your arms and legs move around it. So get in a comfortable position for your back. Think about gently pulling that belly button in. Arms are gonna come up. My left arm's gonna go behind while my right knee marches. So it's here. Notice nothing else is moving but that arm and leg. And then we're hopefully alternating. Sometimes the coordination part gets tricky. Trust me on this one. So if you need to stay on one side at a time, you certainly can. Now, if that is too much to start with, a lot of times I will start with just that march to really focus in on engaging things. So again, no arms this time. And really making sure those hips stay level and the back is not arching or the stomach is not blooping out. And then to make it even more difficult, bringing those legs all the way up. Now this one is definitely tough because the tendency is to either arch or bloop that tummy. So don't worry, this one may take a little while to get to. And sometimes, and I've certainly been in this place, that there are just times I just can't do this one, and that is okay too. So bringing those legs back down, you made it through, you got all the exercises in. Yeah, you're gonna rock it. Just make sure you know also, you don't have to do all of these all at once. It's totally okay to break them up and do some one day and some another day. Always, always, always listen to your body, and thank you so much for tuning in today. Thank you so much for tuning in today, you guys. If you want to get rid of pain anywhere in your body on your own with just one little portable device, don't forget to check out the Derma Edge. I created this while I was going through Lyme disease to help get rid of my pain on my own, nice and gently. It's patented and made in the US, actually right down the road in Laconia from where my office is. So don't forget, you can click the link here or in the description to order your own.